Welcome back to the Champlain Fall Prevention Education module for seniors. This is session 2. My name is Christine Bidmead at the Regional Geriatric Programme of Eastern Ontario. In this session, we will be reviewing what we talked about in session 1 and then looking at some other things you can do to reduce your risk of falls and injuries. I hope that by the end of this session, you'll feel armed with some valuable tools to work with. So we will quickly refresh your memory about what we covered in session 1. We talked about the many reasons for falls and what you can do to prevent or reduce the risk of falling for yourself or someone you care for. Screening yourself using the Staying Independent checklist is one of the best things you can do, as it covers many areas of risk. It can be found on the www.stopfalls.ca webpage. You can print it off to fill in later, or you can fill it in online and then print it to share with your family and healthcare provider. The information is not monitored, saved, or shared when you complete it online. A medical review with your family healthcare provider is very important. Remember to tell them about any falls or near falls that you may have had since you last saw them. A review of your medications with your doctor or pharmacist will make sure that you're not taking anything that may no longer be necessary or is making you more at risk of falling. Having annual vision and hearing tests is also a good way of taking action to reduce your risk. And we will be covering physical activity in a little more depth this session. The You Can Prevent Falls pamphlet is available on www.stopfalls.ca as well, and is useful for checking your house and home for any hazards. Looking at places where you might need a rail or a grab handle is a good thing to do, and maybe with a family member or caregiver, as they may have noticed areas where you struggle a bit to reach or to step. We talked about the My Falls action plan and covered the ones I have checked off. The Staying Independent checklist, regular medical checkup, vision and hearing checkup, medication review, regular physical activity 150 minutes a week, strength and balance exercises twice a week, and a home safety check. And this form is available on stopfalls.ca and from your public health agency website as well. And now we will look at other parts of the list. On the action plan, what else can you do? We all want to be the best that we can be, and here are some more ways to work towards that goal. And we'll go through these one by one. Nutrition, walking aids, footwear, and risky behaviours. I'm sure you have all heard the phrase, you are what you eat. As you age, your body needs less food, but may need more nutrients, such as vitamins and minerals. Vitamin D and calcium are especially important because they work together to keep bones and muscles healthy. Eat a variety of healthy foods to make sure you get enough different nutrients. The Canada's Food Guide from Public Health was updated in 2017 and is full of information and some recipes, etc. Calcium and vitamin D are very important to protect your bones and muscles. 1,200 milligrams of calcium and 800 international units of vitamin D each day is what is recommended if you're over 70 years of age. Cheese and yogurt can be a good way to add calcium to your diet if you don't drink milk. If you don't get enough milk products or calcium-rich foods, speak to your healthcare provider about taking a supplement. Choose vegetables and fruits, whole grain foods and protein foods that you enjoy. Frozen and canned options can be just as healthy and easier to prepare, and adding herbs and spices instead of salt can make food taste more interesting. As you age, your sense of thirst may decline, but you still need to drink regularly, whether you feel thirsty or not. To stay hydrated, drink water throughout the day and with each meal and snack, and use water instead of sugary drinks. Other foods and drinks that can help keep you hydrated include lower fat milk, low sodium soups, vegetables and fruit, unsweetened fortified soy beverages. Walking aids, the big walking aid question and concern. Being active and using walking aids. So many people avoid using a cane or a walker because they feel it makes them look old or frail. It is a tough step to take to help make steps easier. You will be able to walk better with a cane than limping because of pain or weakness, And of course, you're less likely to fall as the walking aid provides support if you feel a bit wobbly or are on an uneven ground. Using a cane or walker can improve the way you walk, your ability to step evenly, make you safer, and allow you to go further with less pain and stress on your joints, as it takes the weight off a painful joint such as a hip or a knee. Limping due to a painful joint can add additional strain to your back and your good leg, so using an aid can make you stand straighter and walk more normally with a smoother step pattern. Using walking poles is an excellent way to get out and about, and there are Nordic pole walking groups in some neighbourhoods. Using an aid such as a walker can improve your endurance as it reduces the load on your joints and allows people to get out and be able to go further. Do you need balance support or taking weight off a painful joint? Do you hang on to furniture as you move around the house to give yourself stability? Do you struggle to step up onto a curb or a step that doesn't have a railing? A physiotherapist assessment is recommended to make sure that you have the right aid that fits you and your needs and to be taught how best to use it. The physio can also help if there are other issues that are affecting the way you walk. Using the cane that belonged to your great uncle Fred or your next door neighbour is not a good idea, as the cane or walker should be adjusted for your height and for your needs. There are adjustable canes, there are canes with different types of handles for those with arthritic hands, etc., and different bases, such as the one that has a 4-footed base. You can use ice pick tips in the winter. A physiotherapist can make sure you have the right aids for your needs. You should also make sure that the rubber tip or ferrule is not worn smooth, as it can slip on a dusty or wet surface. Where to get a walking aid? Canes are available at most pharmacies, but should be adjusted for your needs. And walkers can be rented or bought at rental supply stores. If you need a walker most of the time, you may qualify for the provincial government funding called the Assistive Devices Programme, and many physios are licensed to assess you for that programme. Nordic walking poles can be bought at many outdoor sporting stores, and there are classes available where you can learn the technique. The greatest health risk for older adults is living an inactive life. And if you don't use it, you lose it, and never has that been more important as you get older. You need it, which is activity and the ability to move, to do things you enjoy doing, like gardening or hobbies, family activities, enjoying your pets. You need it for the things you need to do, like preparing food and carrying laundry, groceries, etc., and things you must do to be independent, like toileting, bathing, getting in and out of a chair or a bed. In session 1, we covered physical activity, and we know that activity is beneficial for many chronic conditions such as arthritis, low back pain, fall prevention, heart failure, coronary artery disease, lung disease, chronic fatigue, and diabetes, to mention just a few, and it can make you feel more confident and positive. There are different exercise classes for different needs, with a focus on strength, balance, and mobility. And the main thing is that you should enjoy any class you do so that you'll continue to take part. We will go through the different levels of class that are available, and this information is also on the website under which exercise class is best for me. Not everyone likes a group class event, so find a way of getting that strength, balance, and mobility exercise that works for you. Strength and balance are especially important for those people who have difficulty moving around. So I'm quickly going to go over the 3 levels that you can use to decide what type of class you should be joining. There is nothing worse than being in the wrong type of class. Either it's too difficult for you and you may get put off by that and not go back, or it may be too easy and not challenging and you'll get bored and it won't be a benefit for you. This level, the high level of activity, describes someone who probably is already exercising or quite active and would be looking for something that can be found in your local community centre or online. Look for something you enjoy. Racket sports or dancing, for example, are both excellent ways of being social and active. You would be looking to improve your fitness level and endurance, as well as your strength, balance, and flexibility. The next level, the medium level, is for people who are worried about their balance, can stand on one leg for 2 seconds, but no, not much longer, can climb 10 stairs, stand for 20 minutes, and walk a block without losing breath or having to sit down. The fall prevention classes, such as Stand Up or Better Strength, Better Balance, are very appropriate for this group. This level applies to someone who is beginning to have some worries about their balance, and these classes can improve your strength, balance, and endurance, and therefore your confidence. There are many people who are not able to move easily without becoming unsteady, or who may need the help of a walker, and who often think they therefore cannot take part in any exercise opportunities. There are a large number of chair-based exercises that can help improve balance, strength, and flexibility, which can lead to improving mobility. They give good support while you reach and move, using bands and light weights to improve your strength. There are chair-based yoga sessions, for example. It is a good idea to talk to your family health provider and complete the Staying Independent checklist that we talked about in session 1. There are also classes that are available for people with certain conditions, such as arthritis, stroke, Parkinson's disease, etc., and the local branches of the various societies, such as the Arthritis Society and the Stroke Association, can help. Why are your shoes so important? Your shoe gives you stability, gives you comfort, reduces pain, protects your feet, especially important if you have poor circulation or numbness like with diabetes, shock absorption and support for all your lower body joints, reduces slipping, and warm winter boots in the winter are especially important, and using grippers is also important in the winter. Let's go over some of the components of the ideal shoe. There should be good space between the end of the shoe and your longest toe. About 1/4 of an inch is good, and there should be good depth in the front of the shoe to allow your toes to move around. Laces or Velcro to make sure you get a good fit that's adjustable if your feet begin to swell or you wear thicker or thinner socks. The back of the shoe should come up off your heel so you get maximum support and don't slide out of the shoe. The heel should not be too high. 1/4 of 1 inch is best. The heel should also be wide enough to have good contact with the ground. A sole that gives the right grip for indoors or for outdoors, depending where you are. You need to have shoes that don't have such a strong grip that they stick to the carpet, for example. And as I mentioned, grippers that attach to your winter boots are very good for walking outside when there's potential for ice. Risky behaviors. There are many ways to avoid risk without limiting your independence. Common sense is the key, and as we get older, we should all be using all the common sense we have learned throughout the years. We know that alcohol and drugs can affect your balance as well as your reasoning, and the mixing of the two is not a good idea. Moderation is the key, and using that common sense you have gained over the years. Kitchens and bathrooms are often the site of a fall as someone reaches for something in a cupboard or a shelf that was convenient many years ago but isn't now. Think about where things are and move the things you use often to a more practical level. This goes for sheds and garages as well. Ask for help to change smoke detector batteries and light bulbs and cleaning gutters or outside jobs that need a ladder, especially if you know you have balance concerns. Again, using common sense to prevent a fall. Steps and stairs and slopes or walking on even ground need special attention, so concentrate on what you're doing, especially if you're on unfamiliar territory. Paying attention to dizziness. What can make you dizzy? Understanding what can make you dizzy can sometimes help change your dizziness. Dehydration can make you dizzy. If you don't replace the fluid that your body uses during the day to keep your body machine going, like digestion, your kidneys and your muscles, etc., you will find that you will get dehydrated. You need to drink 6 to 8 glasses of fluids, including water, but not necessarily all water, each day, or as directed by your healthcare provider. If you have heart failure or kidney disease or take water pills, make sure you talk to your healthcare provider about how much you should drink. Dehydration can also be caused by medications, such as diuretics or laxatives, or some medical problems such as diarrhea, vomiting, heat stroke, high blood sugar, etc. Medications that you might take for depression, sleep, blood pressure, or other heart problems can cause a drop in blood pressure. Talk to your doctor and pharmacist to make sure you're on the right dose. If you do feel dizzy, or your healthcare provider has told you that you have postural hypotension, there are some things you can do. After lying in bed or sitting in a chair, clench your fists and circle your ankles 10 times. This helps to raise your blood pressure before you get up. Maybe just try that just now. Stretch your feet out in front of you and move your foot from your ankle so that your foot makes a circle. This helps getting the blood moving around the body, as well as getting your joints and muscles ready for action. At the same time, make a fist and stretch out your fingers. Make a fist, stretch out your fingers. Make a fist and stretch out your fingers. Do this 10 times for your fists and your ankles, and then slowly get up. If you start to feel dizzy, just sit down again or lie down again and repeat your ankle and hand movements, and then try again. Now, this is an excellent page to read and review. It's a good time to do it when you're feeling fine and are not on the ground after a fall, so you have an idea in your head of how to cope and get up from the floor by yourself after a fall. You can find this document on our stopfalls.ca website, along with all the other resources that I've mentioned in these 2 sessions. If you can, try and print it so you can go over it with a family member too, and you can visualize what the steps entail. It's also available through your public health unit. It's important to know how to get up safely from the floor if you have fallen and are not injured. This document was created when an ambulance service visited the same woman 11 out of 13 days in a row because she had fallen and didn't know how to get up. She was never transferred to hospital because she was never injured. It's important to know how to get up safely. Please note, do not try and lift a person after they have fallen. You may hurt yourself or hurt the person who has fallen. If you're injured and cannot get up, call for help. Consider having an alert system or carry a phone with you. The alert systems work best, of course, if they're on your person, and some of them look like a wristwatch and some can be worn around your neck. They really don't work well if they're on the top of the fridge, on the bedside table, when you have fallen in the living room. How to get up off the floor. I'm just going to go through this sheet, so try and follow through with the diagrams to get a visual picture. In the first picture, you have fallen and you're on the ground. To just try and sit up and then roll onto your side, and if you can, get onto your knees so you can crawl to the nearest chair, couch or bed. You can always scoot on your bottom if your knees are not up to kneeling or crawling. Take your time and move a short distance at a time. It may take you a while, but there's no rush. You can't fall any further when you're on the floor. Once you get to the chair, that's in picture 3, have a rest. Maybe grab a cushion if there's one in reach. You might be more comfortable kneeling on one for the next step. Turn to face the chair, as in picture 4, and put your hands and arms on the seat and push yourself so that you have one foot flat on the floor. Lean forward and push up with the other foot and get yourself somehow onto the seat of the chair. Take your time, and once you've landed on the chair, take some good deep breaths, have a rest, gather yourself together, and tell someone you've fallen. If you're injured, then you need help. While you're waiting for help, try and keep warm. If you can, grab something to cover yourself with. If you've had a bladder leak and the floor is wet, then move away from that spot if you can so you don't get cold and wet. Try and move your arms and legs if you can to keep the circulation moving. One good idea on this list is to have a phone buddy who calls you every day, and you can call them so that you both know that you're okay and can get help if you don't answer. Not all falls are preventable, and some falls can result in serious injury. A fall or a near fall can sometimes be a warning signal that something is wrong. Maybe you fell, but didn't hurt yourself and feel it's not worth worrying the doctor. But if that fall was because your medications needed review, seeing the doctor could prevent a worse fall next time, maybe with an injury. Falls can act as a red flag, so always tell your healthcare provider if you've had a fall. If you feel dizzy or drowsy or have new aches or pains after a fall, go and get checked out and explain how you fell. Did you trip over a rug? Did your knee give way? Or did you pass out? All of these clues will help find the real cause of the fall that can be prevented in the future. So now we have covered all the things that you can do to prevent falls and prevent injury. The action plan is complete, and I hope that this has helped you feel more prepared and able to take control of managing your health and being as active and independent as you can. Thank you. Thank you for taking part in this education session. Please visit our website www.stopfalls.ca to find and download the resources that we discussed in this presentation. And if you have any questions, feel free to email rgpeo@toh.ca.